That is another session of this series of anatomy videos, which we will complete the discussion on the anterior abdominal wall. So that's what we call it the part 1B. In the previous one, we have described the superficial fascia and the muscles on the lateral wall of the anterior abdominal wall, the external, internal, and transversus abdominis muscles. Here we'll start by the rectus to continue the muscles of the anterior abdominal wall. That is the rectus muscle, which is found on each side of the middle line. This is the linea alba here, and that is the two sides of the rectus abdominis. The lower one here, lower muscle, is what we call it the pyramidalis muscle. We'll come to it. So that is the rectus. It arises by two tendons, a lateral one from the pubic crest, and this is the largest one, and medial one from the superior pubic ligament. The insertion of that muscle is up into the 7th, 6th, and 5th costal cartilages. It is intersected by 3 fibrous or sometimes more fibrous bands or between the parts of that muscle, and these bands refer to the development of such muscle from more than one somaite. It is supplied by the lower 6 thoracic nerves, so it develops from the lower 6 thoracic somites, which fuse together to form that muscle. That is the indication of the fusion of all the muscles, of all the somites to form one muscle, which is not seen in other muscles. So that is the intersections. One at the level of the umbilicus here, second opposite the free end of the xiphoid process, and the third midway between the umbilicus and the xiphoid process. These are the three tendinous bands. The nerve supply, the ventrami of the lower 6 or 7 thoracic nerves. Small triangular muscle which may be absent, that is the tensor linea alba or the pyramidalis muscle, which can be seen over here. It lies on each side of the middle line in front of the rectus and within its sheath, that is the small muscle here. Its origin from the pubic crest and the superior pubic ligament like that of the rectus, and is inserted into the linea alba between the umbilicus and the symphysis pubis. That's why we call it the tensor linea alba. That is the insertion. The nerve supply, the subcostal, the action pulls down on the linea alba, making it tense. The intercostal nerves can be seen also here on the side wall of the abdomen, which have been seen in the previous session. And this is the ilioinguinal nerve down here. Again, one of the nerve supplies of the anterior. So that muscle, the rectus abdominis, is enclosed in a sheath. We call it the rectus sheath, which is formed of anterior wall and posterior wall. Let's start by the anterior wall. We have two lines here to divide it into 3 areas, area 1, area 2, and area 3, by a line at the xiphisternum and line midway between the umbilicus and the symphysis pubis. So that is the area 1 here, which lies above the costal margin, and this formed by the aponeurosis of the external oblique muscle only, the only muscle which passes above the costal margin, and as we know. That is area 2 here, which lies between the costal margin and the line midway between the umbilicus and the symphysis pubis, and this area is formed by the aponeurosis of the external oblique and the anterior lamina of the internal oblique aponeurosis. Then this is the area 3, which lies below that line, and it is formed by the aponeurosis of all the 3 muscles. So that is the anterior wall of the rectus abdominis, of the rectus sheath. Now, the posterior wall of the rectus sheath, which is formed of 4 parts, that is the first one, second one, third one, and fourth one. The area 1, this one here, has no wall, and the rectus muscle lies directly on the 5th, 6th, and 7th costal cartilages. The area 2 is a small area of almost 2 to 3 centimeters formed by the fleshy fibers of the transverse abdominis. Area 3, the largest one, which ends down midway between the umbilicus and the symphysis pubis, and is formed by the posterior lamella of the, or lamina of the anterior oblique and the aponeurosis of the transverse abdominis. The lower part of this part, the wall, or the third area, is called the arcuate line, this arching line here. The last area, the fourth area, this one here, there is no, again, no posterior wall, and the muscle lies directly over the fascia transversalis. So there is no wall above and no wall below, is only that of the transverse abdominis fleshy fibers, and both the aponeurosis of the transverse abdominis and the posterior lamina of the internal oblique. That's all about this rectus sheath. Now, that is again the muscles together, all the muscles of the anterior abdominal wall shown in that diagram here, on that cadaveric piece. That is the external oblique here and here. That is the aponeurosis, which form the inguinal ligament. That is the internal oblique, which is reflected here and here. It is cut to show the transverse abdominis. That is the transverse abdominis over here. And this is the inferior epigastric vessels. That is the rectus abdominis above with the intersection, and that is the reflected part of the rectus abdominis here, is reflected to the medial side, which should not be the same in surgery. If you want to reflect the rectus abdominis during surgery, you have to reflect it laterally to avoid injury of the nerves and the vessels which come from the lateral side. And this is the tendinous intersections. Here is the posterior wall of the rectus sheath. Deep to the rectus sheath is the fascia transversalis, which is a layer investing the whole anterior abdominal wall deep to the muscles and superficial to the extraperitoneal fatty tissue. So it is the thin connective tissue lies between the internal surface of the transverse abdominis and the extraperitoneal fat. In the inguinal region, to support that region and the inguinal canal, it is thick and dense. It is a part of the general fascia between the peritoneum and the abdominal walls, as we will see when come to the abdominal cavity. Superiorly, it is continuous with the subdiaphragmatic fascia. On each side, it becomes continuous with the fascia of the posterior abdominal wall, where it will split to enclose the kidney. Below, it is continuous with the fascia iliaca, which blends with the posterior surface of the inguinal ligament, but it will pass, that fascia iliaca will pass in front of the femoral vessels to form the anterior wall of the femoral sheath. That is the lower part here. It is pierced by the spermatic cord, forming the deep inguinal ring, half an inch above the midpoint of the inguinal ligament. And the prolongation from that fascia at that point surround the spermatic cord and passing through, forming what we call it the internal spermatic fascia. The inferior epigastric artery can be seen here, piercing the fascia deep to the rectus abdominis to reach the rectus sheath, where it will pass in front of the arcuate ligament. Now we'll come to the deep arteries, which are 4 arteries: internal mammary or internal thoracic artery and vein are shown here. Superior epigastric artery and vein, that is the one here. The musculophrenic artery along the costal margin here. That is the external iliac vessels. The inferior epigastric artery and vein, which arise from the external iliac artery, and that is the deep circumflex iliac, which again comes from the external iliac. So they are 4, 2 from the external iliac and 2 from the internal thoracic artery. Let's start by the inferior epigastric artery, which is the most important one of the 4 arteries. That is the inferior epigastric artery here. It arises above the inguinal ligament at the mid-inguinal point from the external iliac artery. It ascends upwards medially within the extraperitoneal fatty tissue, as all the structures in the abdominal cavity will be lying within that fat, behind the posterior wall of the inguinal canal and medial to the deep inguinal ring, reaching the lateral border of the rectus abdominis, which will be almost around this point here. It will pierce the fascia transversalis and lies behind the muscle directly. Lastly, it will pass in front of the arcuate line to enter the rectus sheath and ends at the umbilicus by anastomosing with the superior epigastric. The artery raises a fold of parietal peritoneum on the posterior surface of the anterior wall. This is what we call it the lateral umbilical fold, which marks the lateral border of the inguinal triangle. The branches of the inferior epigastric, that is the one here again, is the cremasteric artery, which enters the deep ring to the inguinal canal, accompanying the spermatic cord, and anastomose with the testicular artery to supply the muscle and the other covering of the spermatic cord. The important one is the pubic branch, which passes close to the femoral ring behind the pubis and anastomose with the pubic branch of the obturator artery on the pelvic surface of the lacunar ligament. In 30%, a large branch, this branch becomes large and replaces the obturator artery, which is called the abnormal obturator artery, which is important to know during operations on the hernia or on the pelvis itself, the bones of the pelvis. Muscular and cutaneous branches to the muscles and the skin of the anterior abdominal wall. These are the branches of the inferior epigastric artery. The second one is the deep circumflex artery, again a branch of the external iliac, that is the one over here, passing downwards and laterally toward the anterior superior spine, then behind the inguinal ligament and the fascia transversalis. It anastomoses with the lateral circumflex artery of the femoral the iliolumbar artery, superior gluteal artery, and lumbar arteries of the aorta around the anterior superior spine. The musculophrenic, the last one, which pass along the costal margin here, is a branch of the internothoracic, lies behind the costal cartilage to supply the intercostal spaces and the upper abdominal wall. The superior epigastric artery, this one here, is one of the term branches of the internal thoracic or internal mammary, descend between the costal and xiphoid slips of the diaphragm with its own vein, enter the rectus sheath behind the rectus abdominis and runs down to anastomosis with the inferior epigastric artery at the level of the umbilicus. Most of the time it is found within the substance of the rectus abdominis. That is the inferior epigastric. Lastly, these are the umbilical folds which can be seen from the inner aspect of the anterior abdominal wall from the after reflection of that anterior abdominal wall, as you can see here in that cadaveric specimens here and here. In the middle line, this is the median umbilical ligament, which represent the remnants of the urachus, which is attached to the apex of the urinary bladder. The second one is the medial umbilical ligament. That is the urachus here, that is the remnants of the urachus here, and that is the lateral umbilical ligament, which is formed by the obliterated umbilical artery. The lateral fold, which is formed by the inferior epigastric, is this one, that is the inferior epigastric artery here and here. So that is the lateral fold, that is the medial fold, and that is the median fold as seen here, also the median, the medial, and the lateral. That is the arcuate line, which represent the lower border of the posterior wall of the rectus sheath. That's all about this part of the anterior abdominal wall. Thank you.